Hi, congratulations. My name is Nandi. I'm one of the student midwives on call today. Is it okay if I do your newborn exam? Awesome. So I heard you have baby right at 40 weeks, so we've had our first feed with some solid sucking and swallowing and a good latch, and the baby's had their first feed and their poop. Is that correct? Awesome. Well, let's go and get started. So I just want to look at her general appearance, looking at her behavioral state. I see that she's in a awake, alert, kind of state right now, just looking around, just trying to figure things out. She also has really good movement of her four extremities. I see that they're moving smoothly and symmetrically. I'm looking at the tone of her skin. She's got good perfusion. She's nice and pink. Integrity is great. She's nice and warm to the touch. She has a little acrocyanosis in her hands and her feet, which is normal at this time, and it'll go away in about a day or so, okay? She has a nice, easy work of breathing. Her belly is going up and down, nice and easy, smoothly, symmetrically. I don't see any retraction, no nasal flaring, so that lets me know that she's getting some easy breaths, and she looks nice and pink, so that is a great sign. I'm gonna go ahead and start at the top and look at her head. So I'm looking at her scalp and her hair. I don't see any missing patches of skin. That skin is intact. No bumps, no lumps, no lesions. I'm feeling her anterior fontanelle and her posterior fontanelle. Those are both flat and smooth, so no concerns there. She does have a little bit of molting, but that'll go away. She had to fit through that tight canal. Give it a few weeks or so, okay? Let's move on to the eyes, and then we'll do the ears. Eyes first. So she has proper spacing in between her eyes. She has about one palpebral fissure length in between her eyes. Her eyes are perfectly set with the tops of her ears. I'm looking at her conjunctiva. It's nice and pink and profuse. Her sclera is nice and white. There's no secretions coming from her eyes. I don't see any trauma on her face either. I'm just going to grab my pen light here and elicit the pupillary reflex. I see that those are both intact, so it lets me know cranial nerve number 2 is intact, and also my ophthalmoscope about 6 inches from her face, and I see that nice red reflex, that red reflection of her eyes, okay? Going back up to the top, I'm gonna elicit the Moro reflex while we're here, just so I can examine a few more things. So I'm just gonna gently lift her up like so. I'm gonna make her feel like she's falling just for a moment, just to see if we can get that startle reflex, all right? Beautiful, and that is exactly what I expected. She kind of fanned those arms out and brought them back to her body in a startle motion. That kind of upset her a little bit, which is okay because that lets me know that her facial symmetry is intact. That lets me know cranial nerve number 7 is intact. I also see that her uvula is lifting midline, and that we also know that her sucking was good because she had a good latch, and I'll assess that myself in a second. That lets me know that cranial nerve number 9 and 10 are intact, okay? I'm gonna move on to the ears here. Looking at the pinna is well formed. I don't see any dents, any extra skin tagged. The cartilage feels well formed as well. I'm just gonna kind of pin them to her head and let them go, and she has a great recoil, which is the expectation for a term baby, so that looks great. I'll move on down to her nose. Her nose is nice and symmetric. I see that septum is symmetric, that mucosa looks good. I'm gonna just check patency by occluding one nostril and then the other, and it sounds like she's got some nice patent nose, still was able to maintain that easy work of breathing. Beautiful. And when she did that, I also saw her tongue lift up midline. That lets me know that cranial nerve number 12 is intact. All right. So moving on down to her lips and her mouth. Her lips are nice and pink and perfused. I'm just going to look inside at the bottom of her mouth. The roof of her mouth, that soft and hard palate are intact. That mucosa looks great. It's nice and pink and profuse. Those gums look nice and pink. The frenulum underneath the tongue is an appropriate length, so I'm not concerned about a tongue tie. There's no lesions, there's no bumps. All the skin is intact here. And I see that like I said, I saw that uvula lifting midline as well. So I'm just gonna palpate also the bottom of her mouth, and I can feel her suck that is well coordinated and it's strong. I can feel her soft and hard palate are intact as well. Beautiful. So I'm just going to remove my finger gently. While we're here, I'm going to elicit the rooting reflex by touching her cheeks on both sides. and she kind of turns her head to each side in expectation of a feed. That lets me know that she has a rooting reflex, and also that she has good movement of her head from side to side. So cranial nerve number 6 is intact. Awesome. So we have cranial number 5 from the rooting and the sucking, cranial number 7 from facial symmetry, 12 from the tongue lifting, and then cranial nerve number 6 moving from her head from side to side. Okay, so moving on down, I'm looking at her neck. I'm just going to palpate gently, make sure I can't feel her thyroid. I see that her trachea is midline. There's, excuse me, no webbing of her neck, no bumps, no lumps, nothing to be concerned about there. I'm going to go ahead and palpate her clavicle as well. Going down the length, it's nice and smooth and intact. I'm going to check out her arms. Her arm length is equal in size. She has some good range of motion in her elbow, good range of motion in her wrist. 0 degrees on that square window of her wrist, which is expected in a term infant. Her palmar creases are intact and well formed. I see about 3 lines. She has 5 fingers on each hand. No extra fingers. No webbing of the fingers either. I'm going to do the palmar grasp. She's grabbing my hand nice and tight right there bilaterally, and it's nice and symmetric. I'm going to elicit the arm recoil, holding out her arms for 4 seconds, letting them go, and she kind of recoils those arms back towards her midline, which is what I expect. Let me feel those brachial pulses. And they are brisk and bilateral, nice and strong, and yeah, equal on both sides. Beautiful. I'm gonna check out her scarf sign. When I do this, I expect to get some resistance for her elbow to come about midline, and it does. And then on this side, and same thing. Beautiful. Moving on down to her chest. So her work of breathing is nice and smooth, like we spoke about before. Her skin looks great. I don't see any bulging from her belly. I'm looking at her nipples. Her areola are appropriate in size. There's no extra breast bud tissue. It's appropriate for her gestation. There's no secretions. And that looks great, okay? And going back to her overall look, I don't see any signs of trauma anywhere thus far. So that is a great sign. Going down to her breath sounds, I want to listen in 5 different areas for 1 minute. So I'll do that now with my belly and my diaphragm. And everything sounds crystal clear. There's no crackles, there's no rails, rhonchi, or wheezing. I'm also going to listen to her heart with the bell and diaphragm for 1 minute. And 5 different points: Erb's point, mitral, and tricuspid. And everything sounds nice and clear. There's no clicking, there's no murmurs, there's no gallops. All right. And since she had her first feeding, I should be able to hear some gastric sounds. So I'm listening now, and I can hear some gentle gurgling, which is exactly what I expect. Now I'm going to go ahead and palpate, nice and soft and deep. Light and deep on both sides. And bilaterally, I don't feel any lumps or any bumps. And it looks like she's nice and comfortable when I do that, so I'm not concerned there. I'm going to palpate her liver ever so gently. About 2 centimeters underneath her rib cage, I can feel a nice smooth line of her liver. That lets me know that it's there and it's not swollen. All right, so moving on down, before we get to the lower extremities and her genitalia, I'm gonna go ahead and bring her on over. Looking at her back here, that skin is intact. She's got some good skin integrity, nice and pink and warm and dry to the touch. I'm gonna just trace my finger down her spine. It is midline, there's no curvation. She's got nice glute form here. It's symmetrical on both sides. There's no sacral dimpling. I'm just gonna elicit the truncal reflex on both sides. And she kind of curls and has good tone on both sides. And she has also good tone in her head. She's able to keep her head up a nice distance, which is nice and expected for her gestation. I'm gonna gently bring her back down. I also want to palpate her clavicle, the length of her clavicle. That is intact, feels nice and smooth. I want to palpate her humerus as well. And that is nice and smooth and intact. So I want to come down and feel her femoral pulses, and that's nice and brisk and strong bilaterally. Looking at her genitalia here, her labia majora is appropriate for her gestation. I'm just going to separate with my gloved fingers here. Beautiful, and everything looks intact. Everything looks well perfused here. There's no bumps or lumps. Her perineum length is appropriate, and her bottom looks appropriate as well. And we know everything works because she had her first pee and her poop. Awesome. So moving on down to her lower extremities, I'm looking at her legs and I see that they're equal in length, as well as her arms were equal in length. She's able to wiggle those extremities, just kind of moving them around symmetrically and smooth. So that is great. While I'm here, I am going to check out some range of motion. So I'm going to do heel to ear. She gives me resistance at a proper or expected angle for her gestation, and then the popliteal angle, beautiful. She gives me resistance at an angle that I would expect. I'm going to look at her little toes and feet. Her palmar creases are intact, well formed here. She has 5 toes. There's no webbing of her toes either. I'm going to elicit the palmar grasp by just stroking her feet down. She kind of fans her toes towards me, or down rather, and then stroking up to elicit that Babinski, and she kind of fans out those toes. We checked out her movement. Now I'm going to check out her hips here. So while I am here, I'm going to elicit the Barlow sign by adducting here, and no clunks, and Ortolani sign. And I don't feel any clunks in her hips, so good movement, good hip form there. And then Alice sign by planting her feet. I'm just looking at the height of her knees, and they are equal in thighs. Before I move on, I'm gonna come back up for her ears. Checking out her pinna and the form of her ear. I don't see any fissures, any extra skin tags. I want to kind of lay those ears down and let them go for that recoil, and it is nice and brisk, which is expected in a term infant. And that is it. That concludes my exam. Everything looks great. Congratulations again. If you have questions, just let us know.